for the invitation to speak. Flew in from Buffalo early this morning. It's my pleasure to talk a little bit about our research on robotic disclosures and the literature, especially relating to robotic versus laparoscopic cholecystectomy. As I sat through many of these talks over the years, most people say no disclosures, me included, and this year I get to claim my first disclosure, which is kind of exciting. So as part of the background, researchers' conflict of interest present potential bias and compromise study quality. It's important that surgical journals, peer-reviewed journals, and the reader both know if there's any real or perceived biases among the researchers and of the journal itself. We chose this topic because of the exponential penetration of robotic platforms in surgery, and for the first time ever, there's so many billions of dollars involved with surgical platforms and disposable instruments. So with hospitals, investors, and surgeons all vying to try to figure out a good interplay between the dollars and financial incentives of robotic industry and the advances with minimally invasive surgery, you have to come to a point where everyone can trust that there's accurate disclosures. Admittedly, this is a very complex relationship between surgeons and industry because there is much needed education, training, which we all agree would be important, and it's also important for the company, robotic companies, to invest in surgeons' performance. However, research is unique because by gaining research dollars, there is secondary gain for the researcher and potentially the company, and these need to be identified. So conflict of interest disclosures and accuracy should be considered even more important given the impact on both the clinical reasoning of the people reading the research as well as patient ability to discern the data. So peer-reviewed journals in surgery particularly and authors are both responsible to make sure that this high bar in ethics is met in medicine. It's important to also note that real and potential, that is the appearance of impropriety, could also be just as troubling as real bias, and it can undermine confidence in clinical decisions based on the clinical literature. So with the advent of the CMS Open Payments Database in 2014, where industry is required to list all of the dollars that are given to physicians in the pharmaceutical and industrial complex, it's very important to understand that the reason that this was legislated and funded by CMS is to promote a more transparent and accountable healthcare system. And through the Sunshine Act, as also it's known, we examined the conflict of interest in robotic versus laparoscopic cholecystectomy in the literature. The reason we chose this topic was because of the high stakes dollars involved and the gray area of authors saying there's no impact on my research despite my reception of dollars, because clearly this topic is related to robotics, and that's why we chose it, focus on this. In our research, we found there was both journal failures and author failures, and I'd like to present the data to you. So by using PubMed and Embase, we were able to find the robotic versus laparoscopic papers from 2014 to 2020. We compared that to industry payments in the CMS Sunshine database. We verified these disclosures and established if there was concordance. We searched cholecystectomy and laparoscopic and robot-assisted from the years 2014 to 2020. We came up with 345 original peer-reviewed manuscripts with no duplicates. And because the Sunshine Act only applies to U.S. physicians, we were able to identify 37 papers that compared robot-assisted and laparoscopic cholecystectomy and their conclusions. So in our disclosure assessment, we asked, did the manuscript have a clearly published statement of disclosures? Interestingly, in all 37 papers, all of the journals had a COI disclosure requirement. Did all co-authors have a disclosure statement? That is, are all the authors listed on the paper specifically and explicitly disclosing? And we verified the accuracy of the disclosure on CMS Open Payments Database. So of the reviewed manuscripts that came out with a robot-assisted cholecystectomy equal or superior to lap chole, 70% concluded that RAC is equivalent or superior to lap chole, and RAC negative papers where manuscripts where authors were concluded was not superior to LC, 30% of the papers were negative. So of all of the 37 papers, 70% of the papers were deemed positive or equivalent to lap chole, and 30% were deemed negative. 1/3 of the manuscripts on this topic had at least one U.S. author who had a conflict of interest to disclose, and they were very similar between the groups. So while all journals required the disclosure of a COI, only 31 of 37 manuscripts had a disclosure. In other words, there was a journal failure on 6 of the manuscripts, despite their own requirements, that they did not have a statement at all on the disclosures of the authors. Of the 31 manuscripts that had disclosures, 26 of them matched the industry-reported payments. Robotic-assisted cholecystectomy with a COI statement and robot-assisted cholecystectomy positive manuscript without a COI statement as compared to the negative papers showed that the papers that had negative were more likely to disclose than the papers who were positive. The concordance between authors' conflict of interest self-reporting and industry-reported papers were quite different between the robot-assisted negative papers and the robot-assisted cholecystectomy positive papers. Interestingly, on all of the authors in all of the papers, over 50% of all dollars from all sources were from robotic industry. And among the positive papers, 98% of all the robotic payments went to authors of positive papers, and only 1.5% of all the robotic payments went to authors of negative papers. So the quality of studies were pretty interesting. There was only one clinical trial in all of the US-based one-author literature comparing robot versus laparoscopic, and that was a single port robotic paper. And the retrospective cohorts were the majority of the negative papers. The larger, smaller single institution studies that revealed a positive outcome were more likely to be single surgeons and single institutions. So as we zoom out and look at multiple hospital, multiple surgeon databases, the positive outcomes for robotics increased. And as you zoomed out and looked at more hospitals, more surgeons, it decreased. As you zoomed into single hospitals, single surgeons, it flipped. So some of these qualities were for cherry picking. That is one criticism, that the more patients, more surgeons of varying experience and more sites tended to be negative against the robot. Fewer patients, expert surgeons tended to have more positive outcomes. So for example, in manuscript 14, they had no conflicts of interest to disclose. Their bile duct injury rate was lower. Their conversion to open was lower in comparison to a New York State database that showed that robotics actually had 3 times higher common bile duct and twice as many open in conversion to opens. Interestingly, the author had received $100,000 from robotic industry and did not disclose it in his paper. And he acknowledged that skipping over the first 125 cases in his series, that is, every surgeon that had not yet performed 125 robotic cholecystectomies was excluded. And some people have criticized this to jump over the learning curve. So the dollars, payments made to authors, I'll finish up. Payments made to authors increased with positivity, and more interestingly, after a positive paper came out, the payments to those authors dramatically increased from robotic industry, where the negative ones didn't change. So conclusions, journal editors and authors alike are failing. Only 70% of the manuscripts followed their own disclosures, and robotic industry payments specifically examine robotic and laparoscopic cholecystectomy definition can be deemed not relevant because it's on the robotic topic. So our proposal is a CMS open payment passport receipt like ABS board certification, should be verified by the journal, time dated, and we should trust but verify author disclosures to make sure that all the conflicts are disclosed appropriately. Thank you.